The last thing, really fast, take 2 minutes to do. Statistics. This is what what you really need to understand. Statistics you need to know. This is from 2013. All right, and I want you to pay attention to it because it's going to change, I think. What's going to happen here, the number one, you have to know the 10 killers, and you need to know them in order. Hint, hint. And they asked that on the test. You need to know what the 10 top killers are in America, because that's what's going to be on your boards for radiology, nursing, doesn't matter. They're going to ask you for these things up here. There's going to be 30 questions on probably your boards on heart disease and like cardiovascular and heart attacks. 30 or 40 questions. Are they going to have questions on Down syndrome? Yeah, maybe 1 or 2, because that's not one of the 10 top killers. You need to know the top killers because these are the people that are walking into doctors' offices and hospitals. So they want to make sure that you know all about this stuff. Does that make sense? But things will change, and that's why I want you to know them in order. Heart disease, you know, is the number 1 killer in America for both men and women. Cancer's there too. But this is November 2016. Cancer, as of now, was 599,000. Heart disease is 601,000. They think that this year, cancer is going to break it. We're only 1 month away. Does that make sense? What's that? No, I'm saying by 2017. They're saying in 2016, they're saying that cancer may overwhelm the heart disease of killers. Right now it's not, but it's only by a few thousand. Okay? Now that could mean 1 or 2 different things. And this is how you have to think. It could mean that cancers, we're not preventing them as much, and that's why they're increasing. Or we're preventing heart disease much sooner, and you're not dying from it. You've got to look at both ways. You're going into the medical field, you're going to see that. One of these is actually increasing besides the cancer. The other one that they're looking at is accidents, unintentional accidents, opioid killing. Drug use, street drug use is climbing fast. And they also think that that's going to go higher than emphysema. So things are changing, and that's what you have to be aware of. So right now, I want you to know these in order so that you could appreciate what things are going on. Okay? People don't even think that Alzheimer's disease is up there. Oh, you forget something. How could I kill something? That's not what you're killing. You're dying because, yes, the memory goes first, but the Alzheimer's disease will affect the brain stem also, and then they're not going to wake up. Their brain is, the brain stem is not going to tell you to breathe. We don't know what causes it. I want you to know them in order. I want you to know them in order. If everyone here is going to the medical field, you need to know them in order. You need to know. For you to appreciate the field that you're going into, you need to know them in order. All right? I'm probably one of the only teachers that want you to know that, but you will thank me later on, because you're going to see another one climbing up here too. Like there's one that's not on here. This intentional self-harm went up, I think in 2007, was number 11. What was there, which is number 11 now, is septicemia, blood infection. So you should know them in order, and these things will flip-flop every year. But you need to know them, okay? And this is just showing you what's happening, the trends of what we're doing, all right? You don't have to worry too much about that, but that's what's happening, the trends. And right now, life expectancy is almost 79 years old, okay, overall, okay? The other thing I want you to know is this. Now, not in the details. This is the top new cancer cases in America, all right? And this is from 2015, so it's fairly recent. The only ones I want you to know is the top 3 for men and women. You don't have to worry about percentages. You should just know them. That have men. These are the new cases. They're not dying from this. These are the new cases. finding a lot of prostatic cancer. Doesn't mean they're going to die from it, but we're catching it early. So they catch prostatic cancer, lung cancer, and colon cancer. Those are the ones I want you to know. In women, we see breast cancer more common, lung cancer, and then colon cancer. Because we have a prostatic screening test that we do. We can do a digital rectal exam to test for hardness of the prostate. Or we do a blood test also. In women, we have the self breast exam, plus we also do mammograms. So we're picking them up early, but they're not dying from it. However, for the 3 cancer deaths of America, lung cancer is #1 for both. Prostatic cancer and breast cancer move down to #2 as deaths. They're up there, but that's what's happening. And colon cancer has always been third. Okay? Again, I'm not going to ask you percentages. I do want you to know the order for at least the top 3 on both. For the cancer deaths and for the new cases. If you're going into the medical field, you should have some appreciation of what's going on and what your patients have. Instead of just punching in, doing their job, and punching out. You should see what the trends are doing. Okay? And this is just an FYI. When asked what patients like about their doctors, okay, and what they when they want to see their doctor, it's amazing how, like, most of them, they want to make sure that the doctor communicates well, all right, and explains complicated procedures and listens to the patients. That's more important than if the doctor's board certified, number of years in practice, or attended a well-known college. It's kind of an interesting thing. So it's all about you, not about your credentials. It's about your bedside manners, and that's what you have to do. Unfortunately, bedside manners can't be taught. They can only say, you can only say to yourself, what I want to be, and you watch another doctor or watch another nurse and say, you know what, I want to be like that person, or I don't want to do that. It's an art. Okay?